Welcome to the Practivist Pod interview show. Today, I have a conversation about the power of state houses, the push for national single-payer health care, and the national popular vote with Michigan State Rep. Carrie Rheingans. Rep. Rheingans believes that every policy issue is a health issue. Her passion and career have been in the service of advancing health equity. She grew up in rural Michigan and earned a Bachelor of Science, Master of Health, and Master of Social Work from the University of Michigan. Before being elected to office, she was a project director for the Michigan Public Health Institute and a lecturer at the U of M School of Social Work. Carrie is also a member of the American Federation of Teachers, Local 6244, love a union member. She lives in Ann Arbor with her husband and 5-year-old daughter. I'm Steve Pierson, and here's my interview with Michigan State Representative Carrie Rheingans.
Stay strong. It won't be long. We will build a better world.
Rep. Rheingans, thank you so much for joining us today. This is a long time coming, and I'm thrilled to speak with you.
Well, thank you so much for having me. I'm excited to talk about healthcare and whatever else you want to ask about.
I do want to ask about healthcare and some other things, but before we jump into all that, I'd love to just hear a little bit about your journey, because you're a teacher and a social worker. What compelled you to run for office?
Well, I originally, when I was a kid, wanted to become a genetic engineer after I read Jurassic Park in middle school, and
Great
I thought
book.
it was dumb. And I read it as a book, actually, not before the movie came out.
I mean,
And
the
I thought
movie's
it was
great,
really-
but the book is so good.
It is. And it made me think, why are we making like dinosaurs with this technology when we could make food that people could eat that's cheap? You know, at the time, middle school, Carrie thought that we should make rice that had all the vitamins in it. Fast forward to, high school genetics camp for a week. And then I went to undergrad at University of Michigan and studied cell and molecular biology, and I worked in a lab. And that's when I realized I do not want to work in a lab the rest of my life and work with like little tiny tubes with other little tiny tubes with clear liquids. So I also was learning a lot about social justice and, activist movements, civil rights movement. And I got really involved in the HIV and AIDS world and started doing a lot of direct actions and noticing that the systems of oppression that exist around the world and here in the United States really put some people more at risk for HIV than others, and that it's not fair. And so that's when I realized, what I really care about is health disparities. So I went back to grad school for public health and social work, dual degree, also at the University of Michigan. And I worked in health policy for a little while after that. I worked at a health policy center based at the University of Michigan that helped roll out the Affordable Care Act in Michigan. So I was like the nonpartisan policy expert on panels for our state lawmakers as they were deciding whether or not to expand Medicaid eligibility. And our Congresswoman, Debbie Dingell, who is a Medicare for All advocate. And so I was like the policy person on those panels and also doing some advocacy, to expand Medicaid in Michigan. And ultimately, I saw that our State Department of Health and Human Services didn't always do what I wanted them to do. But when a lawmaker introduced a bill to make them do something, they said, wait. We could do that without making it a law. And so I realized, maybe I should try to make the laws here to make the department do what we need it to do. And so with redistricting in Michigan in 2018, voters said we want an independent redistricting commission, just like you have in California. So we redistricted in 2021.
But will have again, yes.
You did have. Yeah. But there was some political drama out of DC that is forcing you to temporarily change it.
Correct.
So in Michigan, we had independent redistricting. And so I happened to live in a open seat. And so I ran for that in 2022. And I ran as a woman, health policy expert, while COVID emergency was winding down and Roe v. Wade was being overturned. And I won my primary 2-1. And then it's a fairly strong Democratic seat. So then I was elected, and I've been in Michigan's House of Representatives for 2 terms. And I'm running again.
Amazing. And I love, a lot of people running for office, you and I both see this. They run for it's the question that should be the easiest to answer is often the hardest, and that's why are you running?
Yep.
They don't have to answer that question very often because usually the first question is how much money can you raise? And that one's easier for them to
Unfortunately.
answer. Yeah, yeah. But I love having folks in office that really know their why, to steal a phrase, and are in it because they want to make change and have passion for a specific area. So let's start with talking about healthcare and your work now. As you articulated, you've been a staunch advocate for Medicare for all, but not just in Michigan, organizing a coalition of state house reps across the country to advocate for federal single payer. Can you just talk about your work on this and what you've done so far?
Sure. Yes. So yes, of course, people hear about Medicare for all, and we would love, Bernie Sanders, who's been calling for it for years, to get that passed at the federal level. Congressman Dingell and Congresswoman Dingell have also, introduced bills over the years, and now Congresswoman Jayapal is taking that on in the House. And it has not yet happened. There is not yet enough people ready to vote yes for that in Congress. So in Michigan,
And
I actually ran.
certainly not when Republicans are in power too.
Certainly not. Temporarily in power.
Right.
So when I ran for office, I actually ran on universal health care in Michigan, and there was another Ann Arbor representative who had previously introduced a bill called My Care. In Michigan, we call everything MI something, because that's our acronym or our abbreviation. So I ran on introducing My Care. I didn't run on passing My Care. I ran on introducing it because I knew that it would be an uphill battle to get it passed in my first term, should I be elected. So I actually came in as a first-term member with a class of first-term members in the Michigan House that were more than half of our House of Representatives, Republican and Democratic side. And then it was the first Democratic trifecta we had in Michigan in 40 years. So Governor Whitmer is a Democrat. Our Senate flipped to Democratic control for the first time in 40 years. And then I came in as a first-term Democrat in the majority in Michigan's House. And I actually was told, please don't introduce this, because then everybody will say Democrats want socialized medicine. And that's when I realized, oh, even Democrats don't understand what this is. It's changing the payment structure. It's not, using eminent domain to take over all of the healthcare delivery system in the United States or in Michigan. It's just changing how we pay for it. And I mean, let's face it, this is America. How you pay for healthcare determines how it's delivered. So the payment drives delivery. And if we change the payment, we will ultimately change the delivery to be more patient responsive and patient first instead of profits first, which is what it is now.
Yes.
So I introduced the bill, and the bill, I was told, would get no hearings, no attention. So I decided I don't need to have hearings with my colleagues in Lansing. I'm going to take this show on the road. So I did over a dozen town halls in last term, from peninsula to peninsula in Michigan. We have two. And so we heard from people all over the state that they really wanted to see how this would be possible. It's an uphill battle. We need federal approval to use federal funds and other things. But this term, with Trump in the White House, RFK in the Secretary of Health and Human Services, Dr. Oz as CMS administrator, people are seeing our public health system and our healthcare system get slashed left and right. I mean, the big bullshit bill, as I call it, took $1 billion from Michigan's budget last year, and it's going to get worse this year. And
it'll get worse after
thousands
the
of people.
midterms too, because a lot of those healthcare cuts are set to take place after
right.
everyone votes.
That's right. But they know about it. They're pissed. And I have done over a dozen town halls in 2025. I'll be doing probably close to 20 in 2026 here in Michigan, and people want it. I was just at Michigan's Democratic nominating convention, and it's the biggest one we've ever had. Tons of energy. And people came up to me and said, hey, you're the one pushing my care. You're the one trying to do Medicare for all in Michigan, right? And I mean, dozens of people over the course of the day. People know about it. People want it. So I've been doing that on the ground here in Michigan with colleagues across the state hosting me in their districts or groups hosting me. I even do virtual town halls, and I can share information with you about one coming up. But we are now reaching out to colleagues in other states. So I contacted my colleague in Ohio. She's in Toledo, not too far. So we've actually met up and talked. I contacted about 24 state lawmakers from coast to coast, even Hawaii, where they have introduced bills. Some have introduced it for years and years. I know in your state, I've contacted that representative,
Ash Cholera, yeah.
Assembly Member Cholera, yeah.
Yeah.
And so we are all in a group chat. We share information. We have met in person. We're trying to start a caucus, national multi-state legislative caucus. And we have a goal of introducing a state-level bill in every state in the first quarter of 2027. Some states only introduce bills in the first 6 weeks or, 3 months
Right.
in the 2-year term. So we want one in every state, and we still need to find some states, bill sponsors in some states. But if we have every state demanding this at the state level in 27, that's going to spark a conversation for the 28 presidential primary. And I'm hoping that we can help force the conversation at the DNC to make them have to endorse this as something that the presidential candidate will run on.
100%. Yeah. I mean, from the rubble that the Trump regime leaves behind, and you articulated it well, the damage that's been done to our healthcare system already, and what's to come is really amongst the many, many terrible things this Trump regime is doing is maybe has the most long-term damage. But with that, we need to rebuild, and we need to build a new body of government that really, truly serves all of Americans. And I think that we both agree the cornerstone of that new construction has to be Medicare for all. And in my mind, we've never had a better opportunity to really get it passed because, they're doing a good job of decimating the ACA, which they've been trying to do for years and years. And we're going to have to rebuild our healthcare system. And now is the time. And so I'm so grateful for all the work that you're doing. And we have examples around the world. Mexico's President Sheinbaum has just instituted universal health care in Mexico.
That's right.
The Center for American Progress just announced their patient bill of rights. How does those actions help, broaden our coalition and push this even further?
I think a lot of Americans these days are looking around thinking, like, what has happened here in this country? The rug is being pulled out from underneath us on all sorts of things. Gas prices are spiking because of an unnecessary war. I mean, these things are not what people expected when they voted for Trump. And many of us tried to warn people that this was what was going to happen. I mean, actions speak louder than words. This guy's actions all point.
I may have said a few things to a few people. Yeah, I mean, maybe.
you might have. And so I think people are looking for, how do we get out of this mess and how do we build a new way forward? I do believe that these healthcare for all plans are the new way forward we need. When I worked at that health policy center, my boss actually told me, I'm sure, single payer sounds great. And if we would have started our healthcare system that way, we would have it. But we can't just start over. And I'm sorry to say, friends, we are about to just start over here.
Yeah.
And this time we need to start over the right way that's equitable, that we all pay in so that we all can get what we need. And ultimately, all of us are going to have healthcare needs in our life. And so this is the way to make it so that we can get what we need as we live our lives. And I think, Canada, when they had their national health insurance, they didn't start nationally. They started province by province. That's what we can do in America, right? We can start in Michigan, and then we can compete with other states and see who can be the next state, right? And eventually, we'll be able to tip into a majority, and the feds will get the picture, right? And Mexico is our other
hopefully
neighbor,
California will give you a run for your money there in the race to get this passed.
I think California and New York. State Senator Rivera actually has been working on this for a long time with a really great statewide organization, and they have a bill that would fund it only using state dollars. So I've been talking a lot to him. We're actually going to be on a panel together at Netroots Nation coming up in Philly in June, along with State Representative Gregory Scott from Philadelphia and very likely to be elected State Representative from Charlotte, North Carolina, Rodney Sadler. So he's planning on introducing a bill in North Carolina next year after he hopefully wins his election and
Cool.
gets sworn in. So we'll be comparing and contrasting this. And I think the pressure that we have now from President Sheinbaum doing this in Mexico right next door. I mean, Canada, Mexico, and U.S. are co-hosting the World Cup this year. There's a lot of compare and contrast going on. And President Sheinbaum just helped make sure that everybody in Mexico can get the care they need, regardless of employment status or income. So I think that's a great step in the right direction and a good way to pressure the one country in North America that doesn't have universal coverage, and that's
so
us.
shameful. It's so shameful.
It is. And, the Center for American Progress Patient Bill of Rights is things that we could do now. We could do this in 2026. We could do this in early 2027 as we're on the way to getting universal health care through Medicare for All. But it's going to take some time to implement the healthcare for all through Medicare for All or MyCare or other programs at the state level. So in the meantime, these cost reforms that the Center for American Progress is putting out, those are a great thing to do immediately. And as we are doing that, to also move toward not needing to even have insurance companies with profit motives and just have universal single payer coverage for everybody.
You said it at the beginning. Our healthcare system is just completely upside down and backwards. It is all based around profit and not about patient care, and that's not healthcare. That's something else. But that's what we've had for a long time. And I actually have hope amidst all of the chaos and destruction that we are at a moment in our history when we can get this done. So thank you for leading the way on that, and I feel so privileged to have connected with you on that. Let's switch gears a little bit, though, because you've also been very involved in the National Popular Vote Initiative, and we spoken about this on the podcast as well. I was really surprised at how close we are to actually achieving this and effectively circumventing the Electoral College's inequities. You are introducing this in Michigan this month, or have you already done it? Can you talk about that?
I'm still collecting co-sponsorships at the moment, and we'll be working on that during the next few weeks here. But yes, Virginia just passed this, and the governor signed it, and so now we're at 222. Electoral College votes committed. So once enough states join to get us to 270 Electoral College votes, then the Interstate Compact will go into effect. And then it will make sure that the Electoral College, every election, reflects the will of the people. And this is the only election that happens with a district that is the entire country. I had to win the most votes in my district. I think the president should have to win the most popular votes in their district, right? So, and it's the only district that contains every state. So this interstate compact is great because it actually uses the power of the U.S. Constitution and the Electoral College to let states decide how we award our electors, and then we can award them based on who wins the most popular votes in that district of the entire United States.
Yeah. So just for our listeners to be super clear about what this does is it's a legislation that's passed. It's constitutional. As you mentioned, the Constitution says that state electors can award their electors to whatever candidate they choose to when they come together. So this creates a pact for the states that regardless of who has won the electoral votes, whoever wins the popular vote in that state would get all of those electoral votes. I kind of mashed that up, but does that make sense? Hopefully people understood that. You can explain it better.
There are plenty of times when the popular vote and the Electoral College vote have not aligned, like in 2016 or my first presidential election, which was in the year 2000. And I was so confused. And that's when I became radicalized to support the popular vote being what determines who is elected president.
I think the other thing that it does that's really compelling and important is it takes a lot of power off of 7 states, which are effectively where all the presidential campaigns spend all their time campaigning.
Yeah.
You happen to be in one of them. But
For now, I mean, swing state status is fleeting, right? It's not, Ohio's not a swing state anymore. People don't think about it as a swing state. People don't think about Florida as a swing state, right? So I think for states that think, oh, we like having all the attention, we like having all this money pour into our elections to help, bring the top of the ticket, that isn't a permanent thing. What we need to do is make sure that permanently every voter has an equal vote for the presidential election, and every vote matters. And I think that's what we don't have right now. And so this is why we need to get enough states joining the Interstate Compact to make sure that the Electoral College always aligns with the national popular vote like it did in 2024. I think that's how it should be every time. And I think given the fact that the popular vote and the Electoral College were in alignment this time, maybe more Republicans will be joining us to support national popular vote in the future.
It's a good point. It's actually a very bipartisan initiative, so which is rare these days. All right, one last question that we ask everyone on our show. What is giving you the most hope right now?
Well, I am fresh off of Michigan's biggest Democratic Party endorsement convention that we've ever had. In the past, we've had a few thousand, but we had almost 8,000 people register and attend and vote in our endorsement convention. And I mean, I have to say, these voters are fired up. Now, Democrats don't have great polling right now, and that's because Democrats are mad at Democrats. But what I saw at our endorsement convention is people trying to figure out how to push for the policies we want, like healthcare for all, and protecting our rights and fighting against fascism. And so people were energized. I am physically tired today, but I am mentally very excited.
You don't seem it. You seem great.
Oh, well, I also am just a high energy person. But so I'm getting a lot of hope from the amount of engagement I'm seeing, from people understanding like nuances of government that I haven't really heard people talk about in the past few years. They're asking me, what exactly is due process, and what's the difference between judicial and an administrative warrant? I mean, these are things I've had to introduce bills on in Michigan, right, to try to protect our people from the regime not caring about our Constitution. But I'm hearing so many more just everyday voters talk about that. And that is giving me a lot of hope because honestly, we are going to win with such big numbers in the midterms that just like Viktor Orban, Republicans are going to have to look around and just concede.
Love that. I agree with you. Carrie, thank you so much for all of your incredible work. It's really inspiring, and I'm so grateful that you shared your time here with us today.
Well, thank you so much for inviting me, and I am happy to talk about public health, healthcare, all day and every day. Keep up the good work.
Thank you. Thank you so much for joining us today. Make sure you don't miss our regular Practivist Pod breakdown show every Thursday. If you are able to support our show on Substack, we'd be very grateful for that, and you will get the ad-free version of the show there as well. And if you are finding us elsewhere, please do subscribe, rate, and review our show on Apple, YouTube, or wherever you are listening. And share your show with our friends and family. Make sure they are taking action to help us win. We will see you in the field. And until then, don't forget, hope is in action.